Hi, I'm Billy, the owner of Nurse Billie Aesthetics, and I'm excited to welcome you to this in-depth masterclass on facial contouring. Within this online training, we will cover cheek filler, chin and pre-jowl filler, as well as the jawline. This course is designed to elevate your skills, enhance your confidence, and provide you with expert techniques to achieve natural, balanced, and beautiful results for your clients. Throughout this masterclass, we'll cover the facial anatomy, product selection, advanced injection techniques, and safety considerations to ensure optimal outcomes. Whether you're a beginner looking to build your foundation or an experienced practitioner refining your craft, this course is tailored to help you excel in the world of aesthetics. A quick disclaimer before we get started: it is your responsibility to adhere to local regulations and professional guidelines. Nurse Billie Aesthetics and Billie do not assume liability for any outcomes resulting from the application of techniques demonstrated in this course. This masterclass is for educational purposes only and does not constitute a formal certification or licensing. Always practice within your scope and seek hands-on training where necessary. With that being said, let's get started. It's really important that you take plenty of before and after photos as well as videos. It's entirely personal preference whether you want to do this before or after you've applied numbing cream. My advice is if you have a full facial contouring, which is going to include lips or nose, you can take the photos prior and then leave the numbing cream on slightly longer for the more sensitive areas such as the lips. This is really personal preference and it's dependent on your day-to-day processes. Patient safety is always our number one priority, and it's the most important thing to have a good anatomical knowledge of the face. I'm now going to discuss through some of the key blood vessels that we need to acknowledge and avoid for cheek filler. So number one is the infraorbital artery. This artery emerges from the infraorbital foramen, which is located below the eye. You can see on the video I have given a rough demonstration of where this is located. This artery supplies the blood to the lower eyelid and cheek area. So we need to be careful and avoid injecting deep or to bone in this area to prevent compromise or occlusion. Number two is the transverse facial artery. This artery runs across the cheekbone parallel to the zygomatic arch, and it supplies the lateral cheek, and you should be very cautious when injecting laterally on the cheeks. Okay, so step one, we want to remove the numbing cream. Step two, we want to fully disinfect the skin. I personally use Clinisept for its antimicrobial properties, and it's very gentle on the skin, and there's a very low probability of any irritation on the skin. So the next step is marking up. You want to start by finding the lateral edge of the nostril or the alar base. From there, you want to draw a line laterally which ends just medially to the lateral canthus or the outer corner of the eye. This line helps define the inner boundary of where the cheek filler should be placed, or specifically the medial volume loss. As you can see here, I am using a tongue depressor. Now, it's personal preference. You can use a tongue depressor, you can freehand, you can use calipers. It's whatever you're most comfortable with. Dependent on the client, I often use a tongue depressor or a freehand. Next, we're going to draw a vertical line to the lateral canthus. This will allow us to identify the midpoint or the apex of the cheek, and this is where you will generally find the predominant volume loss, particularly in older clients. Some clients are naturally flat in this area, and often we don't actually need to treat the zygomatic arch. It's more focused on the medial aspect of the cheek. Like we are doing with this client. She is a young client who has some flatness in the midsection of her face, and this was predominantly the area that she wanted to improve. You will find with older clients significant volume loss in the mid-cheek. So next we're going to draw a line from the midpoint to the outer edge of the ear. You can see in this clip here that the line is not perfectly horizontal. It does curve up slightly in order to meet the top of the ear. This is just following the natural zygomatic arch. Lastly, we're going to mark our injection points. The first injection point is going to be the midpoint where the two lines meet. Around 0.5 centimetre from that point, you will make a second mark. Another 0.5 centimetre roughly from that second mark, you'll make a third mark, and the same again for a fourth mark. Now, please note that this is just a guide. Not every single client will need as many markings. Each anatomy is different. Some have wider or narrower faces. So please use your, aesthetic eye and assess accordingly. I've included a still image here where I've marked up the entry points, which will hopefully make it a little bit clearer. It does feel and sound and look like a lot, but with practice, it does become second nature. So when we start injecting, we want to start in injection point 1. We want to deliver anywhere between 0.1 to 0.2 mil of product, dependent on the level of volume loss. Each client will vary. We then move on to injection point 2. Again, we will deliver 0.1 to 0.2 mil of filler, dependent on the client's volume loss and assessment. Don't forget, you can always go back and add, which you will see as the video progresses. So I'm delivering 0.2 in each of the identified markings, and following this I will then move on to freehand. In between the identified marking areas, I will then have a look at the client. Often I will sit the client up, have a little look, and deliver 0.05 to 0.01 mil of product. I call this or refer to this as freehand, just to make it easy to understand. Generally, these areas, you will notice that the transition isn't smooth from the initial injection point. We want to make the whole area as smooth as possible. We want to look for any dips, deficits, or any asymmetries, and deliver the filler accordingly.